What's up, everybody? Dr. Ranen here. Today we have Harley back with us. So if you guys watched our last video, you would know that Harley came in with left-sided medial elbow pain. And during our last session, we assessed his neck, shoulder, and elbow. Essentially, what I found was that there was a combination of things going on. There was some irritation in the neck that was causing some dysfunction in the shoulder, and as a result, some dysfunction in the elbow. So it's been 2 weeks exactly since we've seen Harley. He has seen some improvement in his function and pain. His neck's feeling much better. There are less provocative exercises for the elbow. However, he's still getting medial elbow pain when he rows. So we're going to go ahead and reassess him. We're going to see if some of the muscle stimulation that we did has held on, and we're probably going to get in more and work on the elbow today.
Perfect.
All right,
Sounds
let's get
good.
going. All right, you want to look up for me, please? Any sensitivity in the neck?
No.
All right, look straight ahead. Can you turn and look over your right shoulder? Any sensitivity?
No.
Left shoulder? Any sensitivity?
No. Just a little bit less function there.
Yes.
Just a little bit tighter.
All right, on the left side, yes?
Yeah.
Okay. So it was interesting. Harley didn't have any neck pain as such, but a discomfort over the trap more so when he was working on the laptop. And this has gotten better since our session. Just an indicator that there's potentially something going on in the neck or some type of irritation, maybe a neural irritation, and that means like a nerve root compression, potentially maybe from a disc injury, a degenerative disc. That's a big contributor to this whole issue. Let's get you to leave your neck loose for me. Close your eyes. Any sensitivity?
Nope.
Any sensitivity?
Nope.
Any improvement in range of motion or tightness when I do that?
Yeah, it doesn't feel as bad.
Doesn't feel as
No.
bad. Okay. Leave your neck loose. Any sensitivity here?
No, that's much better that way.
Any sensitivity here?
Nope.
Any sensitivity here?
Nope.
Okay. Let's get you to lift this arm up for me. All the way up. Up, 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 up. Any discomfort?
Nope.
Down. Let's get you to go to the side and up for me, please. Up, 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 up. Any
A little
discomfort?
bit there. A little bit in the front of the shoulder.
The front
there.
of the shoulder.
Yeah.
Okay. Down for me. In and just externally rotate. Any sensitivity?
Just feel it there on the front of the shoulder again.
Here.
There and a little bit lower where the bicep joins. So yeah, around there. And also just right on the top of the bicep.
In
Yeah.
there?
Yeah, in there.
Okay. All right. Let's do some muscle testing. Lift your shoulder up for me. I'm going to push forward, resist.
Yeah.
Go. That's much better. Lift up for me. I'm going to push forward, resist. That's great. Bend the elbow. Hold here for me. I'm going to push down, resist. Great. Make a fist for me. I'm going to push forward, resist. Great. Make a fist for me. I'm going to push down, resist. Fantastic. Okay.
That definitely felt better.
Yes,
There's a
much
lot
more
more strength,
stable.
yeah.
All right, so let's get you to just flex your wrist for me. All right, you're going to straighten the arm and then just extend the wrist as well. Any sensitivity?
No, that's okay.
Let's get you to go back again for me. One more time, forward. Any sensitivity?
No.
Nothing. All right, let me give that a go. Any sensitivity?
Just a bit tight in the forearm, that's all.
How's that?
No pain in the elbow or anything.
Okay. Make a fist for me. Lift your wrist up. I'm going to push down, resist. Any sensitivity?
No, that's okay.
All right, you're going to come in. I'm going to push across. Any sensitivity?
No.
No? Nothing at all?
No.
What else do I want to test here? So, yes. Let's do this here. You're going to turn in for me.
Yeah.
Go. Any sensitivity?
That's where it flares a little bit.
Okay, so
But
this is
nowhere near as
pronation.
bad. Yeah, it's just in here.
Okay. One more time for me. Go the opposite way. Any sensitivity?
No.
All right, so pronator teres seems to be affected as well. Okay, let's get you on your back for me, please. Have you had any soft tissue today?
Yeah, a little
You
bit
have
this morning, but
this
it
morning.
was mainly just a flush. There was nothing,
Okay.
nothing major
Nothing
at all.
specific.
I don't think to be honest, I can't remember, but I don't think she did my arms or forearms or anything like that. It was just mainly
Okay.
upper body and legs.
Let's get you to straighten your arm for me. Turn your wrist in. I'm gonna pull away. You go in, please. Let's go. Go, go, go.
Yeah, that's where a lot of the pain is there.
In the elbow.
Yeah, it's almost wrapping around, so it's anywhere from around that region there, so it's all in that joint there.
Okay. Go in for me, please. Yes, go. Any sensitivity?
No, that's fine.
Okay. Let's test this joint out. Oops. 1 second. Any sensitivity when I push in like this?
No, in the joint. The only thing that I could feel there is when he was pushing the top of my arm
Yes.
out that way. So whether it was the bicep
When
that
I was pushing in.
I'm not sure if it was even just the bicep moving. Where you were
You felt
gripping?
discomfort on the outside?
No, the inside. On the
Yeah?
inside, yeah. When you were pushing the bicep. Not necessarily the joint, but... Yeah, that's okay, that is. Yeah, that's fine.
Okay. So I just want to test the joint because sometimes you can have some medial collateral ligament irritation or instability. Any sensitivity?
Alright, that's fine.
Okay. Let's get this arm over here. You comfortable to have it in this position?
Yeah.
Okay. Let's have a feel here. Sensitive?
I can feel that run down my little finger. It's almost, you know when you hit your funny bone?
Yeah.
That's what that feels like.
Oh, this is very tight in here, hey?
Yeah, that's... Yeah. I can feel that there.
How's that?
Yeah, I can feel you rubbing on that. Yeah.
Are we getting any closer to your point of sensitivity?
It's anywhere around there. Like everywhere that you're pressing is where that pain, yeah.
Okay.
So it's hard to pinpoint exactly where it is, but all of them...
All of these points are sensitive.
All of them points feel...
Let me grab a pen or marker. Starting to heat up in Dubai, man.
I know. This week especially.
Yes.
They've actually said to expect colder weather till the 10th.
Yeah, yesterday was really weird.
Yeah.
Actually wore a jumper to the gym for the first time in a while.
Oh.
Okay. So this, on a pain sensitivity scale, this is less sensitive, and as I go up it becomes more sensitive, yes?
Yeah. That's it, yeah. Whenever you get around there, yeah.
Okay, so that's the most sensitive. Okay, now let's try and find this ligament. How's that?
That's painful.
Yeah?
Yeah.
Okay, so that right there is the medial collateral ligament of the elbow. Seems to be very thick. Let's try your opposite arm, please. Could you bring it back for me? Okay, let's have a feel here. How does that feel?
I can feel you there, but not like on the
opposite side, eh?
No.
This is definitely less sensitive, less thicker.
Which is surprising because I'm right-handed.
So that's interesting. It's a good point you bring up. We often find rotator cuff and elbow injuries on the non-dominant side.
Yeah.
Purely because of the difference in proprioception,
Right.
so the perception of time and space.
Okay.
If you don't actively use your left hand to do something,
Yeah.
other than gymming, you're going to lose, or not going to have necessarily the same proprioception.
Yeah.
So you may think you're moving the weight the same way, but it's definitely going to
Of
be
course,
different,
yeah.
man.
Yeah.
You know, and then you load the elbow incorrectly, you load the wrist incorrectly, the elbow, and then the shoulder. All right, so today we're going to work a little bit more on the medial elbow. So let's get your arm back for me. See how we can make this more comfortable for you. Okay. Do you need me to add in some support somewhere?
That's okay.
Is this
though.
good?
I can tuck it like that.
Yeah,
Is that fine?
you can?
Yeah.
Okay. Actually, you may feel more discomfort in your. Let's see if. 1 second. You're a big bloke, man. So finding the right position that's comfortable
just
for everyone.
Unknowable, no doubt.
Okay, let's maybe have you in this position. Let's get you down. How's that?
Yeah, I can leave
Better?
that there.
You could do that?
Yeah.
Okay. Let's go.
Yeah, I can feel that down the little finger.
Oh, there we go.
Yeah, right.
Nice twitch. All right. 1 second.
It's funny because my fingers do that when I'm pulling sometimes.
Yeah.
Almost like on, when I get a bit fatigued towards the back end of a set.
They start to cramp up.
And twitch a little bit, yeah. Which is why straps are fairly handy.
Do you use Versa grips?
No, I just use conventional wraps.
Okay.
Yeah. I never really got on with the Versa grips. Do you?
I don't, man, but I do follow Dr. Mike Israel,
Yeah.
and he loves plugging Versa grips.
Oh, does he?
Yeah.
You know what? They're probably a lot more convenient than the straps themselves.
Yes.
Just because it's like only one. You only go under it once, don't you?
Yes.
And then it's gripping in. Whereas with the wraps, you spend forever looping it round and trying to tighten it and whatever else.
Sometimes you can't get the right, or it takes, for some, I guess some lifts, it is kind of difficult. Dumbbells.
Yeah.
Dumbbells is tough. How's that?
Yeah, so. Reminds me of when I used to touch electric fences as a kid.
I can't say I did that. Back home in South Africa, those fences would have been very strong,
'cause
man.
they've got a kick, haven't
Yeah. All right, so I'm working on the flexor carpi ulnaris here and the ulnar nerve, which is basically the main supplier of innervation to the flexors of the forearm. There's one muscle called the pronator teres, which pronates the wrist and the forearm. That when we do our muscle test, it produces some pain. Now, the pronator teres essentially attaches here in the medial epicondyle and runs across the forearm like this. However, due to its close proximity to the median nerve, I won't be working on that muscle. In a guy that's Harley size, I would probably only get to that muscle under ultrasound guidance, and I don't have an ultrasound. So we won't do an electrostimulation of that muscle, but we're probably going to get him to start doing some exercise rehab, working on some isometrics and engaging that muscle to help offload the medial epicondyle as much as possible. How does that feel?
Yeah, it's fine.
Good?
Yeah.
Okay.
It's almost a weird relieving sensation,
Yeah.
almost.
Yeah, because I guess your flexors are overloaded,
Yeah.
which is overloading the tendon and
Yeah.
creating that tendinopathy. And this is almost taking the load off those
Yeah.
flexors, right? So we'll do our electrostimulation first.
Yeah.
I'm going to do some dry needling of the muscle.
Okay.
And then we're going to head downstairs and work some shockwave on the tendon
Perfect.
and on the medial collateral ligament. Okay.
That's good.
And I think we'll do some rehab in the rehab room, and we'll see how it feels.
Yeah. Perfect.
Okay. How's your day? Busy?
Yeah, it's good. Yeah, fairly busy to be fair. There's a lot on at the moment. So just trying to be as efficient with time as possible. I had my 2 PTs this morning, then I had my soft tissue work, and then had one call, a few check-ins, and then obviously over here, and then it'll just be straight back to my laptop when I get home. And that's it, me parked for the evening.
Yeah.
And then same again tomorrow.
Coaches these days basically work corporate jobs because they're all working online.
Yeah.
And they're sitting for long hours. I mean, even myself, I'm basically working a corporate job, and most of the time I'm doing physical work, sitting on the computer, writing notes. Yeah. And your body's not built to sit at a desk, man.
No, do you know what? I try and rotate it as much as possible. So like, I've got my office, and then if I need a change of scenery, I'll go to a coffee shop, or I'll sit downstairs. Like, just trying to rotate and keep it as interesting as possible. Yeah. But that's why I do the PTs in the morning. Like, I don't need to do it, but I enjoy doing it, and it's
coming in.
Yeah, it keeps my brain a bit more active with actual human interaction rather than just talking through a phone or through a screen. So yeah, I really enjoy doing those in the morning.
Okay, we're going to increase this slightly.
I'm pretty sure I've had a twitch here before. Like, just randomly get twitches like the same sensation in the same area. Whether that's related or not.
All right, so now for the dry needling, I think I will need you to put this arm in
Behind?
this, yeah.
Yeah, I'll just stretch it out.
Yeah.
Get a bit of blood back in there.
Okay. There we go. All right.
Is that okay in that position?
Yeah, that's fine. Perfect. Okay. Oh, there we go. So you will compete this year?
I'm gonna see. It's hard to say because there's pros and cons to competing. Obviously, the enjoyment of it, the mental and physical challenge,
Yes.
and the actual prep itself, like, is enjoyable, but other areas have to sacrifice, and
Yep.
it's obviously like relationships and socializing, business, cognitive function. Like, there's a lot of other elements that go into it.
Being on calorie deficit isn't.
No, it's not.
fun.
No, it's not. So it's just a case of just weighing things up. I'm obviously doing this photo shoot in April, which is, I'm treating like a prep. I'm obviously not like off plan or anything like that. I'm following a strict meal plan. Obviously doing my cardio, my training, no socialising. It's just that it's not got the pressure of stepping on stage at the end of it, and probably don't need to be as lean. I think for a photo shoot itself.
What body fat percentage are you sitting at the moment?
Honestly, I couldn't tell you. I could not tell you. That's not something that I've done. Probably should, to be honest. Like proper calipers and just find out. And Andy does that, doesn't he?
Yeah.
Yeah, he's very good with those.
It's not fun, man.
No. What, find it out?
Yeah, it's not fun finding out.
Yeah.
Especially after the festive season, when you do that.
Oh, you definitely need
Do
a couple of weeks after just to...
yeah, to get back into the swing
Yeah.
of things. No, bro, that guy doesn't give you a chance to breathe, and you find out that you're like 20 points over. It's like 4 or 5% body fat. Oh, there we go. So we're getting some really nice twitches here. We're kind of in the musculotendinous junction of the common flexor tendon. We're getting some really nice
Yeah, I can
twitches.
feel that.
There we go.
Yeah,
See that
saw
finger?
Oh, that's painful.
Sorry.
It's all right.
What are you training tomorrow?
Legs is tomorrow.
Today's your off day? Or
Yeah,
did you train
today's
today?
rest day.
Okay.
So I'll always try and do my treatment on a rest day, and then I know that I've got like legs to follow. So it gives it a good 48 hours.
What? How do you split your legs? Do you have like a quads
So
day
I have
and a hamstring day, or?
so I have a full leg day, which is obviously everything leg based, but then I have a top up day for hamstrings, just on the back of a pull session.
Okay.
Calves
Is that
I do.
because hamstrings is a weak area?
Yeah,
or?
yeah, just to bring those up, and then calves are just twice a week as well. I'm quite fortunate that my legs respond fairly well, quads especially, and calves. So one session a week on those is enough. I like doing calves twice just because it's one exercise.
Yeah.
Yeah.
Okay. So let's get you to sit for me, please. That's going to feel a little heavy and sensitive.
Yeah, just let some blood come back to it.
So essentially what happens is the muscle is what starts to get really tight and pulls on the tendon, and that creates how can I say, not friction, but abnormal tendon mechanics.
Right.
And you have tendon disorientation, tendon fiber disorientation.
Yeah.
And over a period of time, that's how a tendonitis develops, or a tendinopathy. So what we did with the needle is trying to release, or the dry needling is trying to release some of the tension in the muscle to offload the tendon. Can you make a fist for me, please? We're going to test pronation now, okay? Yeah. So you're going to turn inwards for me.
Okay.
Go.
No, there's nothing there.
Nothing there?
No, it's only where you've needled, so
that's
it's more
sensitive.
so in the into the muscle itself.
One more time, make a fist for me. Go.
No, that's okay.
That's good?
Yeah.
All right, great. Okay, guys, so we're going to head down to the modality room now, and we're going to use some shockwave therapy. Give us 2 minutes, and we'll be right back. Okay, guys, so we're down in the modality room, and we're going to use some shockwave therapy on Harley's forearm now. So shockwave essentially was designed, or... One second, let me just move this here. Oops. Sorry. This is a mess, big mess going on here. Okay guys, so we're down in the modality room. We're going to go ahead and use some shockwave on the tendon here. Initially, shockwave therapy was used to break down kidney stones. Some genius decided to adapt the technology to use for healing instead of breaking down. And shockwave therapy started to get used on the treatment of tendon injuries, ligament injuries, and in some cases, for healing of non-displaced fractures. The research is really amazing in terms of its effectiveness. So we're going to go ahead and use it on the tendon now. Sensitive right there, yeah?
That's okay there,
That's
actually.
okay?
Yeah.
It's better after...
Yeah, that's
after the knee.
getting there. Yeah, there.
Okay. So, with shockwave therapy, you are going to experience some discomfort, okay?
Okay.
5 to 6 out of 10 is what we're looking for.
Right.
Essentially, what the shockwave therapy is going to do is it's going to break down the most superficial layer of tendon, and which is most of the time disorientated, disorganized, and it's going to break that layer down, and it's going to facilitate a new collagen healing mechanism. So it's going to stimulate the body's response in terms of depositing more collagen fibers on the tendon. And it's also going to facilitate a new healing response, more blood flow to the area. It's going to push out all the inflammatory fluid that's in that area. And the third thing it's going to do is it's going to help regulate pain and discomfort. All right, shall we get going? How's that?
Yeah, it's okay.
All right, I'm going to increase the pressure. How's that?
Yeah, it's going to sound that it's there. Can I increase the pressure? Certain areas are okay.
certain areas it's more sensitive.
Yeah, they're fine. It's more so on the outside areas. Yeah, still there.
All right. Let's get you to go ahead and shake that off. How was
Strange.
that?
Yeah, it's
Strange
fine.
feeling, eh?
Yeah, it's very strange. I didn't know what to expect. I've never had it before. The pain that I was experiencing from the dry needling is gone.
It is? Yeah.
So that's now gone.
So what Shockwave does is it actually cancels off the neurologic component of an injury.
Right.
It works on what's called the C fiber.
Yeah.
So that's pretty interesting.
Yeah.
All right. So now we're going to do a nerve desensitization. Okay. Now this one may feel a little stronger. Okay. It's going to just kill off any like new nerve endings that have formed on the surface of the skin, and we call this neurogenesis, and this occurs when you have an injury that's been there for a prolonged period of time. Okay.
Right.
The body starts to send blood flow to that area to repair it, and you have increased blood flow to the nerves in that area, your sensory receptors, and you have new nerve endings that start to grow.
Yeah.
And that's how, or part of the, the chronic pain cycle. Or it contributes to the chronic pain cycle rather. Okay. I'm going to reduce the intensity here because this one can be quite a shock. Okay. All right.
Yeah. There we go.
So you are experiencing more sensitivity closer to the ulnar nerve. So I'm going to work around this space, okay?
Okay. Are you inflicting as much pain as possible?
In a way, we do want some discomfort, but I don't want you to be jumping out of the table. How's that?
That's fine. There's no discomfort there at all. The Shockwave is worse.
How's that?
That's fine.
No issue?
No.
That's pretty good.
Okay, yeah.
Yeah?
Just there, that's where I can feel it, yeah.
Anything down here?
Nothing there.
Yes, yeah.
Yeah, just on that one spot, that's it.
Any sensitivity?
No. Yeah, in there. Yeah. Oh.
How's that?
Yeah, we felt that one.
Done.
Perfect.
Okay. Give me a second. Let's get you cleaned up. Not too bad, eh?
No, I think the Shockwave actually felt
Did
more
its job,
uncomfortable.
yeah.
In certain areas, like other areas was absolutely fine, but I guess that's how you
Well,
find
this
out.
is a good sign for us.
Yeah.
Because it means potentially that there's not too many formation or too much formation of new nerve endings in this area.
Yeah.
Okay, it potentially means that most of your pain is just due to the tendon dysfunction.
Yeah.
And that's a good sign for us, because when you have these formation of new nerve endings, it does contribute to the speed of recovery.
Right.
All right,
We'll
let's
take
get you up for me, please. That for me. Okay, and then just go into flexion and hold. How does that feel?
Yeah, that's fine. There's no pain there.
No pain?
No.
How's the weight for you?
I could hold it there, yeah.
It's fine?
Yeah.
Yeah? Okay. So let's just hold and try and get as much squeeze into it as possible. Okay guys, so after Shockwave, especially when you work on a tendon, you want to get a patient to exercise. So what we're doing here with Harley is just a wrist flexion isometric, just to fire up that muscle and to offload the tendon. Exercise rehab immediately after Shockwave has shown to enhance the effectiveness of Shockwave. How's that?
Yep.
It's pretty good?
Yeah, it's fine.
Okay. Let's take that away from you. Okay. So, unfortunately, the gym is being used at the moment, so we're improvising. Let's get you to stand for me, please. Okay, so we want you to pronate. So, you're going to face that way. All right. So, let's see if you can hold that for me. Let's get your arm up here. Okay, I'm going to pull away.
Yeah.
And I just want you to go into wrist pronation. Yeah?
Yeah.
As hard
Just
as you
hold
can.
it?
Yeah, just hold it for me. Yeah. 10, 9, 8, 7, 6, 5. Can you pronate a little bit more? 3.
There?
Yes.
Yeah. Oh, I can go straight over.
2 and 1. Relax. How was that?
Yeah, it's fine. It's good.
Good? No
Yeah.
issue?
No.
Okay, let's try that one more time. All right, let's go in. Get your elbow down to the side for me. Get this down here. There we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Rest. So your hand is shaking quite a bit. Where are you feeling?
It's more so instability.
More so instability?
Yeah.
Okay.
I don't think it's anything there. There's quite a lot of tension on that band there.
Yes.
Yeah.
Okay.
Where was I feeling it? Just the only part that's tender is literally
in there.
on there. Yeah.
Okay, good.
That's it.
Let's do one more round, less tension, and let's see how you feel. Well, if it's not causing you any pain, that's fine. We can keep the tension. All right, let's go. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Rest. Great. Okay. All right. I think that's us for today.
Perfect.
Now, you can continue to do isometrics. Do you have any weights at home?
Yeah.
Yeah?
Yeah, I've got the community gym, which is 30 seconds away, so I do my mobility work, typically on a rest day anyway, so
Fantastic.
I can head over there.
So, what you want to do is, you can take a seat for
Yeah.
me. On like squat rack, sometimes you have these little clips that the bar sits on.
Yeah.
You can put, if you have a band like
Yeah.
the yellow one,
I've got one of those.
you can just wrap the band around.
Yeah.
Okay. So it's quite strong, and then you can hold onto it like this, and then you just want to pronate.
Yeah.
Okay. And you want to hold that as long as you can.
Okay.
Okay. And then for wrist flexion, you want to do the same thing, right?
Yeah.
You want to be at a surface where your elbow is supported, and you want the weight to be heavy enough that you can engage flexion,
Yeah.
and it's a struggle for you to hold it in that
Right,
position. Okay?
Yeah.
Let's test this out one more time. Make a fist for me. All right, I'm going to turn over. You resist. Go. That feels much,
there's no pain there.
much better. Here, I'm going to drop down, resist. Good?
Yeah.
Okay. And here, resist. Oh, you
Which
okay?
way? Which way?
I'm going to push down. You're
Okay,
gonna
yeah, that's fine.
Resist. Go.
Yeah, much better.
Fine?
Yeah.
Much better?
Yeah.
All right. Fantastic. Okay, guys. So that brings an end to our session today. This is a great way for you guys to see, and of course for Harley to see how I work, but it's a great way for you guys to understand the system that I use for managing patients. Session 1 is always to improve biomechanical function, and then session 2 onwards would be to manage and treat the injury itself. You can jump straight onto the injury at session 1, but sometimes we see that patients return with the injury in a couple of months, and we don't really want that. So we improve the mechanics and then we jump onto the injury. All right, so for those people who didn't watch our last video, do you want to share where they can find you on social media?
So you can head over to my Instagram, which is Harley_Judge. That's going to be the best place to find me for now. When I'm back up on YouTube, I will let you know.
There we go. All right, guys. Thank you very much for watching. If you like this video, please hit the like button. Please subscribe and drop any questions you may have in the comment section below. We'll see you soon. Take care.